clear aligners is mainly because of the attachments. So if we see in these images, the small little bump on the aligner surface or the attachments. So there are two kinds of attachments. One is an optimized attachments and the other is a conventional attachments. Conventional attachments is a standard passive attachments. It doesn't cause any kind of a tooth movement, but it is used for the purpose of retention. Whereas the optimized attachments or active attachments and a custom made and which can be used for a precise tooth movements like intrusion, extrusion or any kind of rotation. If we see in the last image, if we see in the the third image, so there is one attachment is on different shapes. That is the ellipsoid attachments, rectangular attachments, vertical attachments or there. So each attachments have their own purpose of producing a certain amount of certain tooth movements like rotation, correction, intrusions and extrusion. So one of the two important attachments are power ridges. Power ridges are nothing but the four rectangular horizontal lines on the cervical part of the incisor, which is especially used in a vertical control of the cases for the incisors. Whereas the other attachments are the bite traps. So it acts like a biplane and it is helpful in correcting the debite cases. So how do we fabricate the aligners? So the first thing is intraoral scanning, and if not intraoral scanning, we can also take a PVS impression and then we can scan and upload in the software. So after the models have been recognized, it will be analyzed for the treatment plan and tooth will section digitally. After tooth has been sectioned digitally, we have to move the teeth according to the desired tooth positions and we will start manufacturing the several aligner trays to get the complete orthodontic treatment plan. So after the tooth movement plan has been executed, then the aligners will go for the fabrication. So this is just a pictorial representation of what I have explained now. So digital image acquisition followed by a treatment planning in the software and 3D printing of the models and thermoforming the clear aligners. So these are the steps especially designed for the Invisalign, where the fourth step is very peculiar to Invisalign system, which is a ClinCheck software. So let's have an overview about this ClinCheck and what does it do. So the virtual setup for the Invisalign branded clear aligner treatment. So this ClinCheck is only for the Invisalign, not for any other clear aligner system. So it is a setup which has to be viewed by the orthodontist. So basically this virtual setup has been formed based on the prescription what we are going to submit to them. So they'll ask a set of 10 questions. For example, sorry for the bad quality of the image, I didn't have a prescription form. If they will ask around 10 questions in the Invisalign system, so you need to answer like how many, like do you wish to treat both the arches, yes or no, or how do you want to correct your debite by intrusion of anteriors or extrusion of posterior. If you fill that prescription form, the technician in the Align system will make the virtual setup according to the answers what you have filled and they will send back to us. So after we receive the ClinCheck, so like it will be depicted like this. So we can able to see the 3D virtual setup treatment planning. So whatever in the diamond shape, the 2, 3. So if we see in this picture, in the down they have written in a diamond shape 4, 5, 2. So that is the recommended amount of IPR we need to do for this certain cases. So the goal of this virtual setup is when modified and completed by the orthodontist, it is to make the individual tooth movements shown in the ClinCheck. And also it is our duty to check the root position and crown position in all the planes of space. So this is one of my patient where this is the ClinCheck, where if you see the down, it starts from 0 and ends in 25. So 25 depicts the number of aligner trays we require. So for the upper, the dark line has stopped at around 19th aligner. So for this patient, the upper aligners are 19 trays, for the lower it was around 25 trays. And if we see the maxillary arch, the orange color things are the attachments. So we need to fix those attachments before we give the Invisalign trays to the patient. So if we see the treatment plan history, that is the comments we need to write to the align technician. We need to tell them that I want it to be like this, I want a little amount of intrusion. So they will correct according to your specifications and they'll send back to us. So this is a small video, like when they are going to send the clean check to us, we can able to see in the composite views, that is from both anterior, upper, lower, right, left. So if you see, these are the attachments. Along with that, if we see, there is a power bridge which has been occurred in 2-1. So that is for the vertical control of that particular incisor teeth. So there are other comparative studies that has been done in relation to the fixed conventional appliance and the Invisalign in terms of speech, in terms of eating restrictions and mucosal ulcerations. So from the study they have concluded, with the help of this Invisalign, whenever we are treating the patients with these aligners, so there is a speech difficulty in the initial stages, but the speech is definitely getting better on using the aligners. Once they are getting accustomed to the aligners, the speech is getting better. Eating restrictions are there with the fixed appliance. There is no eating restrictions with the Invisalign. Mucosal ulcerations again with the fixed appliance because of the sharp objects like wires. And treatment satisfaction more with the Invisalign or any kind of clear aligners because of the aesthetic perception. And regarding the treatment efficiency, there are no difference between the fixed appliance and the clear aligners. Both work good, and efficiency, it is not one is superior and one is inferior. It's in the aspects of aesthetics, definitely clear aligners are doing the good job. So the potential advantages is that it is more of a patient-centered care. So one of the key advantages of clear aligners is the comfort that they are going to provide to the patient, because they can indulge in whatever the food they are going to eat, so there is no absolute food restrictions. Additionally, there is an ability of how they can maintain the oral hygiene as well, to contributes to the better overall dental health. And obviously it is a technological advancement, so there is a precision redefined in every year, and every time they are updating the protocol. So it has not just been limited to the appearance, but it has got a good precision. So whatever the technological advancement has been occurring, with that they can able to adapt the aligners to the unique contours of each particular tooth. So it is not same for all the teeth. You can adapt it to the each patient's morphology as well. And to conclude, the journey from this conventional braces to clear aligners as represents a significant leap in the world of orthodontics. So there is a technological advancements coupled with patient-centered care as well as the technological precision redefined, and the aligners have become a spotlight into the preference for choosing an aligner treatment for almost the adult patients as well. So as we continue to witness the innovations in orthodontic care, clear aligners stand as a testament to the ever-evolving landscape of dental technology, which offering a patient with a more confident and beautiful smile. So after evolution of these clear aligners, the patients are exhibiting a radiant smiles and enhanced confidence with the aligners on. So let's nurture beautiful smiles with whatever the treatment we are going ahead. And thank you for giving me this opportunity. I would like to thank the scientific committee and the organizing committee. Thank you. And I'm open to all.
As a non-orthodontist, how we can go in taking cases? If I have a poor